Yep.
Okay, great. So my first question is a really very high-level question, but I'm curious where you think the wearable space will be in 5 years. And what's your dream? What's your dream?
Oh, I was like hoping you would be asking Tom.
You each get to answer.
We will do that. Wearables in 5 years. Several things. I think one, they will be less weird, so more mainstream, both because of design, materials, science, and just those two things, and also the fact that more people are wearing it, so it's not weird. So more widely adopted. Second is, I think they will either end up being invisible or they'll be beautiful, but they won't be what they are now, which is neither. Well, at least most of the products. And I would say they will probably still be connected to via mobile internet.
Yeah, I think I pretty much echo that. The only thing is, if you look at that technology in Chicago, the tattoo that you could have on your hand, that's probably a more forward-looking idea of wearables, or solutions that you have in Media Lab with really having the sensors in your cloth. More invisible side of that story, and again, going toward invisible band-aids or things of that nature for short term, and for long term you can have something more permanent. I think that's pretty much the idea.
I'm probably gonna disagree just a little bit, respectfully. Sonny, probably the first disagreement, but I think every one of you guys are actually wearing it now, and that's your mobile phone, and you're wearing it, you're using it. I guess to you it is somewhat invisible because you use it seamlessly throughout your day, throughout your nights. But of course, there's another facet of that, which is you can't swim with it, which is where devices such as the Shine will shine in the water and when it comes out of the water. And that's why we are really excited about potentially partnering with these wearable device companies, and hopefully one day they will become invisible. The phone also, hopefully, maybe a chip somewhere on you, embedded within you.
Yeah, oh sorry, I take that. I agree. There's going to be chips. We're gonna be swallowing chips.
No, I didn't want to actually echo phones too much because then it seems that I'm too biased, but I certainly agree with that too.
I mean, I'd like the chip to tell me what I should eat, and when I should go to sleep, and how many calories I've consumed, and what my heart rate is. It'd be pretty cool. Okay, so if you guys were not...
Can we ask a question?
Yeah, no, please go ahead.
So,
go ahead.
Looking for today, let's say not 5 years from now, 3 years from now.
Here, let's have the mic so everyone can hear. Let's just make sure people can hear you.
So I'm just saying, not 5 years from now, a year or 2 years from now, do you see Bluetooth as basically, connect, devices that you want to wear and monitor for the phone, and the phone is like the thing that's connect that stuff to a remote server or stuff like that. Do you see the Bluetooth as the solution, or do you see any other solution?
The protocol.
From the point of view of connectivity.
Mm-hmm.
Should I take? Okay. Well, I was trained at the Double E, but I think that there's a lot of other technology out there, such as sound or higher frequency sound. It doesn't necessarily have to be Bluetooth, and I think that's something, a path that should be looked more into. And I'm still trying to guess what Sonny's device does to communicate. I have a couple of ideas, but I guess once I tear it apart, when I get one, then I'll know.
We're still trying to get to work.
I think there are two levels to address that. Your question is actually going back to addressing the fragmentation in the market. A lot of people are still thinking Zigbee, Z-Wave, everything else. And if we're looking for hubs at home that are supposed to address several devices, we have to reduce the number of standards. So in that respect, probably low power Bluetooth is one of the key components, and low power Wi-Fi is the same. However, for a lot of fitness devices, and maybe later than the first, next year, a couple of years down the road, the technologies that we see here today are going to be, the top technologies and beat that, during the course of time. So it's just two different, I think, needs for the future.
So the quick answer is, unfortunately, I think Bluetooth will be the technology that we'll have to use put up with for the next couple of years. Bluetooth low energy, kind of a misnomer. It's not that low energy. You know, we were really hoping we would get 3 to 5 years of life from our product, not 4 to 6 months. Okay, but 4 to 6 months is better than 3 to 5 days. Okay, and so hopefully there will be new breakthroughs that will enable products that will last 2, 4, 5 years without charging. I mean, how awesome would that be, right? But we're not really there. So there may be other technologies come through. There may be, but battery technology, I don't think that's improving anytime soon. So between power harvesting and just really awesome transfer technology, that's actually low power.
Yeah, I would have a related question, Sonny. Like, what are the technologies that are going to hold you back over the next 2 years? Is it battery? Battery seems to be one of the ones, right? What are the other ones?
Batteries, one. The second thing is, I think one really key thing that I don't know why more people don't talk about it is, so most sensors require, other than motion, okay, but heart rate and galvanic skin response, all that stuff requires stationary skin contact. Okay, those are really limiting factors, and so to the extent that we can have technologies that don't require skin contact and don't require stationary presence, then now we're talking. Because a lot of times it's hard to put stuff that's in contact with the skin all the time, much less staying still. So non-stationary, non-skin contact sensing technology and battery, those are the two big ones.
Okay. Thank you.
One of the things I think about when we talk about wearable devices is the help me, I've fallen kind of wearable device. Nobody's mentioned that tonight, and I think, so I'm curious about your perspective on that. Obviously, it's not big in San Francisco, but I think other places it is. Yeah, exactly. Secondarily, that business model is one of a subscription, certain amount every month. Have you guys thought about that perspective?
So we make apps, and we're limited to what Apple have. Of course, they loosened up their reins on, such as introducing in-app purchase. Didn't have that a couple years ago. Now they have subscriptions. Didn't have that either a couple years ago. Now there's newspapers and books and things like that. So magazines, that are subscription based. And of course, for us, selling apps, of course, isn't a long-term viable solution in terms of scalability. Unless you're Angry Birds or some of those big blockbuster games. So we do think subscription is going to be the next step through some sort of service. And we really think that whether it's the iPhone as a wearable device, the Shine or Fitbit as a wearable device, connecting someone on the other end, it could be a physician, whoever it may be, or someone else, to provide that human interaction. Because that's what actually my friends are worried about, because my friends are actually all doctors. I'm not saying that we're going to replace them, but a lot of their stuff could be automated, but you just can't take away that human interaction, because after all, we are, creatures of Earth.
In terms of fall detection, I think the question, there are many companies actually working on that. In the interest of time, I didn't really go over that, but the mobility and helping elderlies to go mobile, fall detection is one of the key components. We do have a couple of companies in the Valley, and some of them are impressive in terms of their value offerings. The algorithm needs more work. I think they still might not be there, but what they offer is that cloud computing and do a much better processing in the cloud while you get a little bit of the signal and the on the device itself to make the battery life and everything else more efficient. So that certainly is an important item for enabling the mobility. And the second question in terms of subscription, I do see some companies building up the right partnerships with the labs, doctors, nutritionists, and if you look at most of us in the room, we do like to know more about ourselves. And if the right solution is offered to us, we don't probably mind to pay a subscription to get such service. On the wellness and fitness solutions, of course, it might be a little bit different, but on the healthcare, that's what I see. And probably one or two companies really shown that the level of success. Now they are also partnered with fitness, entities.
If a Stux virus can make an Iranian centrifuge spin out of control, why can the virus make park pacers or just a monitor system saying everyone has tachycardia and create havoc in our medical system?
Yeah, so the question is if there's a virus that could inadvertently tamper with the data and imply that a large population has tachycardia. What do you do about that? Is that
yeah, I mean, it's the same scalability that causes mass problems.
Right.
We're not talking about people's lives here.
Yeah, I would argue that we have even a bigger problem before any of that happens, which is, we have all of our financial data and we have tons of technology in the cloud that is driving, many different businesses and ecosystems in the U.S. And so it's easier to attack the financial system than, if you're going to attack healthcare, you can easily
attack anything.
You can attack anything. So I actually think between PCI compliance and HIPAA and everything, I think there's a lot of redundancy and fault tolerance. So I'm not as paranoid about that. But
well, if it's any consolation, apparently Obama just added 4,000 people to the cybersecurity force. So.
Yes, that's true. Yeah.
It's 4,000 people.
Cybersecurity is a big deal. Let me ask one more question here. So, what is your biggest challenge and your biggest opportunity in the next year?
So we are raising a Series B. So fundraising is going to be it's always a challenge. Actually, it's one of the reasons why, like I said, I'm going back to my stories where I knew that I didn't have the resources to fundraise on my own, and so when the opportunity arose, I took it because. I just have ideas that I just want them to be realized, and you're just limited by basically my team was out of Starbucks, and we drank a lot of coffee, and so getting back to the question, sorry, I was getting off. That's definitely going to be a challenge. Fundraise. Once you fundraise, we have the ideas that that I mentioned earlier that we want it to be realized, and then monetizing that is gonna be a challenge, but we think that through some sort of partnerships, because like I said, apps scale. Anyone out there with a phone, App Store, Android, whatever, you can download it. It could be 0 apps downloaded today. It could be 100 million apps downloaded the next day. Apps scale, so from a distribution standpoint, that won't be a challenge. Monetizing it through commodities, devices would be one way, but we think that subscriptions would be the way. The long-term way to go.
Go ahead.
So I think for me, being active also in Europe as a focus market, one of the challenges, I talked to the EU Commission and they believe that this is going to take up only in US because of the incentives and other issues, whereas this may not be the right solution for EU, where health is provided free for patients and all that. But the reality is a lot of this is grass is greener on the other side. We have partners in Europe companies in Europe that integrated 46 million patient records. And when I mentioned that they went to our, visitors from EU Commission, they didn't know about it, although they were part of, team that regulated that domain. The thing is, this is not going to be easily happening in US because of the fragmentation of health providers. So certain items and certain movements is going to be more active in the Europe, where my job is always to really clarify this misconception and encourage the European side also to be as aggressive as the US side.
So I'll kind of comment on Stephanie's question and the other gentleman's question around making money, and but the probably our toughest challenge I see is just really nailing the consumer experience around our products and making it relevant beyond just being beautiful. You know, internally our bar was, let's make products that are beautiful and or comfortable, so comfortable that you'd wear it even if it was broken. Okay, that's our bar. Okay, and if we can get there, I mean, it's a nice looking thing. I don't know, I'm biased, but I'd wear it even if it was broken. But the so that's one, is nailing that user experience. What, you know, so is it insights that really make it relevant? Is it a social game of some sort that make it engaging? Is it a coach? You know, what is it that, man, you just got to have after you buy this that you would convert into a paid subscription model of some sort? You know, like all of the hardware companies, of course, we're all trying to get a paid subscription model of some sort. You know, like we're not going to make money. It's just selling one-off these things. But just to fill out that answer around, you know, how you can make money, I think there's about 5 or 6 ways that we've thought about at both at Accumatrix and at Misfit. You know, you can sell ads on apps and whatnot. It sounds hard unless you can get 30 million downloads like Tom. You can sell hardware. That's also tough, low margins. It's consumables, awesome, if you can get those reimbursed. Unfortunately, there's no consumables around fitness devices, so that's arguable because some of these fitness devices are easy to lose, and so you just keep buying them. 4 is this is something we discovered recently. This is really cool. Is accessories. You know, people might complain about spending $100 on these devices, and they still do it and still complain, but they don't complain about spending $50 for a leather band, a beautiful top green leather band, or $80 for a necklace where you can wear the shine. Yeah, and colors, because it's spent almost from a different pocket. And so accessories is really interesting. You know, it's like, you know, one is like the health pocket, your health budget.
Differentiating yourself.
You know, but the other pocket is, you know, is jewelry and accessories and whatnot, where, you know, it's a different kind of spending, different part of the brain. And then the data part. Okay, that's the last thing. Like, you know, okay, of course we're all after like awesome data, lots of data, crowdsourced sensor data, and the question is how can we make that relevant to potential utilizers of that data, whether it's pharma or whatnot, for user behavior analytics.
I think we have some questions in the audience. Here, go ahead.
Following up on your 46 million integrated health records in the EU, here World Vista has taken Vista Electronic Health Record, EHR, open source and free some time ago, and it's extraordinarily flexible. You can download it for free, and they're also doing a whole lot of work. You know, 2 weeks ago, went to the Vista community meeting, and there's an amazing amount of stuff going on to break it loose and make it attractive to programmers today and that sort of stuff. So. I'd be glad to have you talk to somebody that I know in World Vista.
Sure. One of the key components of that solution actually is that it's opt-out model in Europe. And unless if you go and say you don't want to be there, you're going to be included.
Yeah. But adapting that software in Europe would make it a global adoption.
Sure. Yeah, I'll be happy to talk about it.
I want to try to get a few more questions. Someone in the back.
Hi, you seem to have made very innovative use of resources that are on the handset. Is the mHealth space compelling enough that you could leverage changes into the handset to make some of these applications more accurate, capable, functional, whatever? Why would you not drive requirements in handsets to make them more useful for the mHealth space?
That's a great question. We'll get the mic back. Thank you so much.
That's actually a really good question, and it's something that I've always been wondering about. Why doesn't the iPhone have this? Why doesn't the iPhone have that? Why doesn't it have a fingerprint sensor or a temperature sensor?
Forget about iPhone. Forget about iPhone.
Forget about the iPhone?
Forget about iPhone. Phones in general.
Phones in general.
Yeah, go ahead. Because if you do iPhone, you're stuck. I'm sorry, it's my
well, I guess I am a little biased because, it's the iPhone. And I kind of say it's like you take it away. Then we're going to talk about Android, which of course Samsung is doing extremely well. I mean, things are catching up. I'm actually a little scared for Apple, to be quite honest. And as a developer on their platform, you know, I lose sleep at night for them too. Getting back to what you were saying is, we actually do talk to some of them, such as Intel, for example, to include more sensors in some of their revision phones, you know, Windows and things like that, because they're the ones that who are trying to catch up. So RIM, for example, who brand themselves BlackBerry, I think it was yesterday, they're playing a catch-up game, and it's oftentimes those underdogs who are more willing to listen, more willing to take action and just do, because they're behind. And you know, we would love to talk with them if you know them, because we really think that by leveraging the phone, I mean, it really, to you, it is invisible. And it's not invisible in the sense that you don't care about it, it's that without it, you yourself feel invisible to the world, because no one can contact you. You're invisible. Kind of like with Facebook, it's like, where are my friends? I call them? No, I want to see their posts. Yeah, so like we were saying, I agree, and it's something that, you know, they definitely should do.
Comment?
I like digital devices, but they're a little bit scary. I will tell you a little anecdote. My wife works for a big healthcare systems, and they gave her a nice bonus if she will lose weight. The bonus was doubled if I lose weight. I did lose weight actually, but imagine that these guys get smarter and they give every one of their employees this nice little device that will control, and my wife then will get a phone call at 8 p.m. Dear lady, your husband is not really working enough. What do you do for that?
All sort of questions. Put it on your dog. That's what they did with diabetes. There's a lot of people who use their pets and prick their pets and to get regular readings. Yeah, I swear. Yeah.
Yeah, related question. That was a great question. Because companies like Safeway are putting a lot of money into wellness. And what sort of reception are you getting from the health, wellness, safety areas of major corporations? That would seem to be a great place. In my work, I'm not seeing too much adoption. But what are you saying?
Corporate wellness?
Yeah.
Well,
I talked to several actual players, and again, it seems that it's going to take off when it's really connected or tied to your premium payment. And they have been studies that, you know, they deployed it and they didn't get any adoption the first year as a free service to you. But once they tied it to your premium, that is going to go up. I've seen, again, adoption rates going up at least 20–30%. I'm not saying it's going to go to 90, but definitely a significant increase. And that seems to be the way to go, at least in the U.S. You know, healthcare system.
Well, like Safeway has actually bent their cost curve even over the last 7 or 8 years, and they've actually reduced in many cases, their workers' comp costs, or held them even while the overall health costs have been going up. And it would seem like there's a lot of opportunities for what you guys are doing.
Actually, Safeway has reduced their cost by 50%. They've had a huge, I mean, wow. They've done some pretty amazing things. Yeah, I mean, if you work at Safeway, you're given a choice. Let's say you have to get a colonoscopy. You're actually given the price at different providers, and you have to choose within a range. Mm-hmm. I mean, so they have, of all the companies, they've been the most progressive.
Right. That's something, sure.
Yeah.
Sorry.
So, taking on the two questions that or the comments that the gentleman made, if you see car insurance, you know, they say that if you are willing to put a device on the car to see, you know, how you are driving, and your rates will automatically go down. You think in the future with wearable devices that your premium, you know, will be decided based on the activity that shows up on your monitors, and with that seems like becoming a reality then, you know. forget the cars, we will be wearing it to show what we are doing.
Actually, this,
Here, go ahead.
sorry.
This model is already existing in Germany. Some of the insurance companies have started to give diabetic solutions to their patients, and they don't charge anything for it because they believe that the value is much more for them to reduce their costs. So some countries have started that.
Actually, I want to comment on that, and I think again, cars, I think it's a little bit different because with cars you can actually hurt other people, potentially even kill. So safety is a really big concern. Whereas for yourself, I find that the era that we're living in with all these sitting around and personally for me, I do sit down a lot and I should go about and move about with a little bit of push, perhaps with some sort of incentives. You may find yourself doing that extra. Whether it's 5,000 steps a day or going to the gym an extra one or two times, that these small differences do make a difference. And that's why there's actually startups such as 100 Plus, which are trying to actually put those small differences in numbers in terms of, hey, if you smoke a tobacco today, you actually lose this amount of days from your life based on Practice Fusion's huge amount of clinical data.
If I may just, so really speaking, if your software monitors sleep and whether, so it can tell whether you are liable for fatigue, for example. And if you're driving a car and you're sleeping less, you put one and one together, that means you're more liable to have an accident because you are more fatigue prone because of overwork, and less sleep. Similarly, if you are someone who does not exercise, you may be risk at heart attack, for example. If that is the case and you are driving or you are going, you can be more liable to cause a accident than someone else. I'm just putting these two together. So it can start having implications that you have never even thought about.
But hopefully there's positive implications, right?
Of course,
I mean, you can be warned potentially ahead of an accident or something.
there is always both sides to it.
Right, right.
So
we worry about the negatives first, right? In
No,
this
I understand.
when it becomes personal.
So, to be quite honest and frank, I've actually only slept, 12 hours in the last 3 days, which has just been a tremendous amount of work. My
So
CL
please-
says that I'm a
Please let us
racehorse.
know which road you are going on.
Yes, so we don't know, right? But actually going to the gym, whether it's 4 o'clock in the morning or 8 o'clock in the morning, it takes off a lot of stress on your body. And we actually have an app for that called Stress Check. You might want to check it out. It's featured by Dr. Oz.
So to go even further on that means on the traffic report now they will say on this road there are people who have slept less, on this road there are people who have slept more safer.
Have you guys tried Waze? So the Waze app will have your little picture with your sleep quote and your potential threat.
Get away from this guy. Well,
We only have 5 minutes left, is that right? So I just want to ask one more question. So I know there's a ton of people in the industry, entrepreneurs who are looking at innovation in this space. So I thought I'd ask the panelists, if you weren't doing what you're doing and you were to start another company tomorrow, what would that be? Where is the opportunity for all the people in the room? Free advice. This is free advice.
Does this have to be healthcare or?
No, it doesn't have to be healthcare. It could be anything. Yeah.
So I'm actually extremely biased. I was supposed to be a doctor. I'm doing health tech. But I have a younger sister, and I do worry about her. She's in college, and I'm like, what is she going to do, after she graduates? She's not a programmer, and that's a really tough question. Because the healthcare, like you had said earlier, Stephanie, it really needs to be fixed, and now there's an opportunity to do it, but some of you guys, I love learning, and I think I'm just gonna learn until the day I die. I don't think it's ever really too late to just maybe perhaps get into the healthcare field or go back and become a registered nurse or some of the things that we really do need in hospital. Because my friends always tell me, Brandon, my friend who's in OBGYN, said they're just always short-staffed. We just need more manpower. So for those who want to go back and do that, there's that. I'm also biased toward diabetes. Diabetes educators we're also shorthanded on that. also in services in the community for health as well, such as free clinics. I don't know how much they really pay, but volunteer. You didn't say, but if they're paid or not. But